nya problem Maame bisa we ye ka de enye yare no enti mebisa we na afi yakode yare no so when we say I have had a privilege say nkola nketwa from 7 years 6 years nya ade no ade omuntumi ne omo mothers nkan ibi mu kura to me the pressure to omo parents omo atwa ticket fee abrochire no omo de omo aba they are able to communicate these things with me and there me baby say yeah, one of the issues me face the more me too kwan na mkosho omo how I face that they omo year 6 years 5 years no munya discharge no and bon said they are no but yeah they tell me that omo pant na ase no at this color sample no de no na ehọ no etete ehọ no etete ebi nso de no omusi ata na aye de me nkola na me bon komopa like that age na to 12 they talk to me pa eno no what could be the problem
crowd issue with hygiene and then proper sanitation at the vagina crowd pina no your young girls will feel my educator say kra nyi omu cleaner they bring it at the front there be an infection na how madwene emi hu de ntem say na ompa easy way or no say akona chi na e den ma no nti sometimes e ya na no say one factor or the toilet fin to hoba ha nti ya no bi okrampo okotwe no sanso clean ni yi and measure say menka we nka panties na eta hye no ye wo sha say tutie say ye detail cleaning pa sometimes apply heat to be catch man because onion craft so because a man with me call the crevices pants inside and side no question o sa share ya na sa ba ho this is where hata pants no abonte the hata them nti wi abe ne bom eno nsan to so nti say nkra ne panties no ebi obekra na bia toilet ni bia kan to kwan no na be fa na ni we na peke nti omo de more of ya na hygiene issue any sanitary issues na mo ntwe ni no ene ta hankra no na we be now so this sweet more now udi more sweet more ka you create the good bacteria as the bad ones will grow papa no if you because of sweet now udi more na de enya na betra ho more nti ya na no so
there's no protection
that's right nti ya na no so a factor nti yen try to educate omo with some which me clean omo hu yi ese omo hu yi na for mon cut down on the sweets and this animal na emo.
So at this point do you think we should let the children use wipes instead of toilet roll? The wipes has some kind of what do we call it, prevention distance and it's also there's some liquid in it and all that, so I think even if they bring it front or back, the wipes can help.
Exactly.
So do you think
the tennis say wipes no ya na wo setting even so kohon so ya na emo
and also you're strong
nti why careful I know say you ntimi mbo brand say brand we ne papa ni we ni ade
nti no
why we are not for wife be
so should we use butter? Why are you laughing? Butter in every bathroom. So our brothers and Muslim sisters, no, they wash. So if we use butter, be na ye person yenye ni clean, or we are no we use butter no before the toilet roll. It will clean nice.
So if you can, I say butter, why you careful so by so do you know. Most bit me try to bit me ahokra basi ho because I want to ben pa.
Say ben kure.
Nti yem fa your tissue na yenye ni. So ni indicate o mo no yenye ni. Aha because butter no enye panyin na oyo ndi oya we sa contaminating so no class and alcohol ti what you say. Yes, so our advice yen ko tissue na traditional tissue but yen show how to be mindful on transmitted from the two to na say ho. Aha exactly. All right,
you are watching the biggest and the largest. So doctor, not all genital discharge is infection. One my hu de enye yare no ene kwan a ye betumi afa so se de enkoye sex so e kwan e be fa so abeduru ho na ye nko ogboro na nkasa ho de ye yare no ene the way aye de frafra ni hu a eye se nipa ba akunya sa yare no a wo discharge na onye stable a how betumi akoso because e kromu ano sex ni ya ni chains obi kunu eni obi girl da obi girl ni obi boy da nti no oba no so wompna nti ubekunu na one thing adwira ye nyina nti no tell us the hin na sickness the ye hu ayenye na den ye hwe ni yie pa enye sa ye de be bro ye hu nyina ye be wiase ni ye nyina ye wo yare ba ko
nam kasen ke be hwe mema ne de no
eno ye ko e ho na ye hwe mema ne de so enye yare
that's it
ye hwe no very important
I'm say mema ye wonsuo bi wo yase ho ensuo ntu na menka wasem ba ko ye seminal fluid and na prostate nim say echimo a ensuo tumi ba bonten mo na produce mo no and normally wo ye be ma tini pa wo ko toilet na ta chimo a na hu sa de no now wo chim na wo strain wase ho no emensuo na ho ni bitumi achiba nti ebi ne sa seminal fluid na wo ye prostate nim no ebi also kwa na ye sperms sperms na beta ho enyankoi aha nti na ebia abonten
because o cap ye ma
nti hu a eya na ye chim na wo chim constipation se strain no e na ema ne ba na me grace na me be na pese omo be ma ne kese and a problem there is no medicine in kan ha I be chama na kese
kan ye biom na yenti
there is no medicine say ye cream say ye duro e mo be na kese
ha
de o papa de ma o de be wi asna no ano no
oh
aha in they are applying creams here and there. So cream now apply no, it me call you to anim. Na ma nsuo if my work as an infection. To one I create that issues no. And now you are the friend no pre-ejaculation fluid. Only or ban person more than now more so we say nsuo between ba. And on prepare o you to and say be as sperm say ba enya acidic. International normal anyhow. E ya na clear no so more say me ka fa e man de no ho na. So ntu sa de na emfa nkwohye say infection na wonya na wonum nro yes a mistake and obi on so a or the seminar twetwe ne be ma no yes obi okwa na seminar ne kra na ebisa akọ inside
hey
in the seminar na do twa de bi ko o posa ho no ebitumi wura chemical pi wura
skin no mu eno de
na fa bia wura ano no so all those ones can cause discharges anya infections
what tua wo dick ni by force
sanity enti obi o say mo pai ni nyina yes force na beginem yes a enyama na chemical ni seminar ni nkuna akomu no and I am born a she on pie and infections bia. Nti ubo hobanu aduro sa o se me kwa na makwa ha enuro bia na honom ye ba behwe no na enye bi kwa sometimes interesting we to for doctor menya gonorrhea pa abo me kwa test baba kwa na hwenim. We can claim say gonorrhea based on the symptoms na nti mesre yantu ye bo saneman se be ya ye abuse enuro no antibiotics no nen ko for harmre nemu ye chomo se kotonum 7 days 1 week 3 days a juma ntem ama ho atumi ato kama
abuse body enti mema no so de na omo nso omo ekwan be na omo nso tumi fa so nya because omo de ne de omo pepa ko front o pepa ko tokro no wo down enye ye de na embomu so
enti omo de no ye de making ada say the seminar na say nkubi
e de twetwe
na say bia sperms no e na o chim na e ba bonten.
Oh, okay.
It's yenye omo de na sa kwan so na free ba yes.
Emuda okay and they go straight to the yare ni.
The yare no basically STDs and say STIs. So what I say. Na common one am kind gonorrhea chlamydia. Syphilis and shensu and I say mount discharge and then sansa never. But the two common ipa a time who start discharges no chlamydia or gonorrhea. Now I'm Grace said they kind sex. Now the thing ya night test him ma pa chen mema. Sa enim ya kan say me. So benya because of harm bobia city no. Bibia we inside. It go deeper in it. Nti a month nya be kwosha e ma outside ya nti ma task for them more chen mema. Nti be ma ne de ye de ne hanga bonten. Nti be mu kakaka na wate no hu no asate ye hodwuma. But oba bet machine for so many years. Now I'm quite you crawl into the ovaries any tubes in him echo hardware. And he said, as soon as one who signs or symptoms be a problem. Once after the all they spread into still cannot cover you know they offer the amount. Sana for the spread here. Into basically STI sexual transmitted infection. That's all. Unya true Janai so as BBA. Into the who's 1 year a chest or ban of my amount. And now say be near the wall, so have sex there. Be near the wall. By infant free toilet so. We also could assume that is not true. A sexually transmitted infection. A born to mean Samiano. A true sex pen out to me, a dinner. And then neighbor could be so bad a hard pa herpes simplex virus. On such missions you, a hono, or banas, women who can pa, I shins you be a hard unit. Into women in a true sex. Apart from that, no. Want me and said, I can say, I ain't careful, I will be no. People na benya because for multiple sex partners na hard.
You are watching the biggest and let me ask this. You see there are these girls ni bin so when they menstruate and stop it. Moja ne batwa could that also be some of these infections?
Yes, no something about PID and that's be your fibroid into menstrual fluidness and kebano, bloodness ebano. If you are not bibia blocking no, into ma within that period ebano 5 to 7 days now ebano. Into be obstructing the flow na. It's human neighbor sa. If you also na hormone the hormones na control sa cycle no. I distorted. ebi a progesterones LH FSH saa hormones nyina no e ho aheka ada say chi more or chi less etim mo nya saa problem no and obi o nso a say they can other fibroid basically or if you are a PID infection ho no nti infection can cause menstrual issues pa hard
you are watching the biggest, so now we know nti sesi enu de ye yare no my signs be 5 signs hu a we de wunim se yare bi a wo de won sa hye ho ekeka wo titi wi a ehyehew. We hear all these things nti me ehu 5 major things are we oba mma ne de anitwa ma omo 5 hu we a no de ye infection again. So wunim infection na duro mpo a ko hospital no mo enye no mo hu days omo hu the level a akodu no mo hu say omo be ye wo IVF so omo be ye wo infusion so omo be ye wo say no mo my 5 major signs we are na de abamba ma no so ho no na afi ye hu.
All right, okay. Nti normally the ten say both man men nyina be hu de making nti ni pa say infections are pampan ewo na ebanim nsu na ebanim and no e batwa so just a once or twice or 3 days e bia week ni bia the whole month. Two say e ba say bia only be man oba hia sometimes pains other say be man so banya pains and e bi on pa oba na ma ho ne too wide because nsu tene sa nti ba sa se bo so ne libido oni atinka bia infection timi yesa ma onya sa de no and second thirdly e bi on so onya burning sensations. It's an say mo no te waso na so utra no be mani munti no e mu hyehyew o mu create sports ni kuro o ma rere ho nti bi be twema kope na more that reactions no and the other complex pay hu pa na say so when you careful am grace it mo onya infection so onya infertility e mo awo atwikwa cha so nwokra because it mi ko block tubes no e ma sperms into machine ko ibu on so e manso be gina wo de no ho e sperms o your beman so a e case a ete hu power akon so me ma be na o spermia ne hu so ni ba right ne wa be hia but enso na ba no sperm cells bi ade hu bi anim kojo to bo ne oba hia kama ne hu so ba right enti say complex ne ko eche no entity a de ba no say wa wo low sperm count or untwe ngokra or ban so obenya problem e wo tube nim e betime sisi ana so benya ovarian cyst mo ne ade. These are the issues I say here.
That is when you people do laparoscopy and the rest.
Of course. Any HSG money, I don't know. They will look into it. Now, for me, I want to. I dare message say young people here, no. One can self medication. Don't go to a pharmacy or drugstore first. A honey more drug alcohol koto. But
is there any restrictions with this pharmacy thing? Like when you go out there, even you need to go with. So what's happening in Ghana?
There is one sometimes baby out to see kakra. Pharmacy crowd and pharmacy so ho. Ono nim no ni we ni ade. But drugstores dey and na pharmacies na titi honum. So these are the issues. So etinka minim obi okọ pharmacy a mo an test on kwaya so mo do, which was fantastic. All ba na pharmacy natural test on kwaye. Sometimes ebum yes but ebum so nyane sa. So nti yes regulation ya di na akoso yi. Na ye nyina anim mo every health a bi anim say health person anim say your problem is antibiotics Hygiene and ye Ghana nko Africa bebia so antimicrobial resistance Maame Grace koso pa you don't know when you maybe because money they came
that is a sleeping aid
inti mestre say obia anya very careful because obia person onya hoto nipa na kono so doctor person so hoto to trade one as anya adwuma which one we can cause
but looking at Africans you feel we don't have trust in hospital. And you feel just I get it out of hand and sana yakoho. Why do we have that kind of mindset?
I think say be sometimes someone say what could do life so we could have a be a treatment you on my be officer how be handle no we could be your past experience nurse bi nan kasa yi e office ya hwe ni yenti ya na ina for me sa adwen no nti I think say but also normally no healthcare is very expensive pa it will also officer all kono koye lab koye we fa hani ad no into your shortcuts.
It's because bibia must lab bibi I tell much da bi when ya banko the lab no be ni aju.
Also doctors are not magicians. What they say you hu and you find they be differential diagnostics. So occurs infection na you wana so na gu a e was some test be 3 or 4 e because scan na me hu where it's coming from into koye ba kope.
Just with that machine munim hwe.
Also, to be sure, said to you, on time say a drone no ya there you don't just take medication. So to me, for me to be sure, say drone say the mouth, they bet me aboa no. Also lab no confirming
the level of the damages, you know.
Sanity, I also confirming near where to handle it from. Every quick can you be what do you do? And this all convert dress and young area, doctor no hound, just for your sure. No who dear, yes or the mouth. Into lab, near you twin do the lab. Aha, sanity.
You were a doctor in Ghana. Looking at our mostly poor, let's look at our situation or our condition. Now, you should the youth to know especially, okay? You should the youth to know especially if you should be given any opportunity to meet the president of Ghana, an opportunity is given to you to ask for something that will help, especially the youth in the medical system. So, if there should be a restructure, be a cost. Our medical system concerning sex from 12, they say 9 for from 7 to 19. And then nanka obe pesa abane be share good medical system nimu. Say you to me stop you from having the sex cry. Betumi aye bibi and set up be they can enter there and my opinion a treaty or money ade because I feel so beyond to me na maame nka.
Oh yeah.
Because the chroma alcohol have sex now ko catch on maame say afa be asem. What would you tell the president of your country Ghana? Say opportunity way in why omunye say nka 5 things you will say they should put together in the hospitals. There
should be more public health education said the also the cost more pa. Na fe nya centers oh, once say when they are cheap compound, but they are now on facility. Omo ni niyama itumi ye ni mebebre. Also ye nya baby a most hospitals. In fact, I heard but nya baby no ye be mo aka de a betumi de aye easy testing. Na fe be nya restrictions on antimicrobial resistance na cost no on the no use na say ye more strict on it. So that ya say den say pharmacist na drugstore money ade to be answer na nipa na man no na woni ma de kra ha no. There should be more regulations there. After public health education should be more.
Because school be ananka yesibi wo.
That's when you say I didn't know HIV commission go na any other infectious no so ho yi. Nti say e biem because one HIV at syphilis e hanadwene, gonorrhea hanadwene, e tete no.
Na no so ye common.
Common. Instead de nka any HIV so no. E o say etimi nya centers for infectious conditions almost because they are share kan schools education. Yeah, the picture nature also be anya yare ni say na ye no ye che educate you to come cry at least to prick their mind. Nti I think say education costs more it will really help a lot.